to introduce Dr. Moore here, and he's a licensed doctor. He's going to explain about what it's like seeing abused children in the ER, in the hospital. And I want you to know, and I haven't really introduced myself yet entirely, which I will. But I used to be a medical professional and worked for the ambulance service and helped save lives. But I just want you to know that how awkward it is working in and out of the ER whenever you witness child abuse. You know, we're supposed to report it, and we're supposed to, help keep children safe. But many times we report this stuff, and then those children get put right back in that abuseful home. And in fact, your tax-paying money gets moved through them, and they give that drug-abusing, child-abusing family thousands of dollars to help them. Supposed to help them unite and fix their problems, but statistics show it doesn't fix the problems. And in fact, it turns the medical professional into a person who is now become a perpetrator. And then if you voice out and tell them what they're doing is wrong, then they'll come after you. And so we
how you doing?
Plain and simple, that's how it works. And I'd like to introduce to you a Dr. Moore. Another Dr. Moore. Shirley Moore spoke earlier, and we have another. We have Catherine Moore from Poplar as well coming up before too long. So we have three people with the last name of Moore. Thank you, sir.
Thank you. Thank you very much, and I appreciate the opportunity to speak here. Zena had asked me several months ago to talk about the problem of child abuse and the abuse of adult protective service measures, particularly from a physician's perspective, and the interface between the medical system, the legal system, and the parent. A lot of times the family involved in in a child protective service measure perceives the physician as the villain, and really that cannot be further from the truth. In the emergency rooms, in the operating rooms, we see the victims of horrible, unbelievably awful things that would give you nightmares. It is certainly where my nightmares come from. I have seen things that I wish I had never ever seen. It is a terrible, terrible thing. I recall a case several years ago where a baby was brought in about 12 hours after delivery that had been forcibly sodomized by the father because the mother had an episiotomy and was not interested in relations that day. There is nothing that trains you in medical school, nothing that trains you in your medical career to deal with such unspeakable horror. The thing that has struck me throughout my medical career is how often we will reach out as an advocate for the victim and have the alleged person who's supposed to be there to help them, Child Protective Services, never even return our phone call. There was one day a couple years ago where in the course of 24 hours I treated two children who had been horribly, viciously attacked. One child had over 50 burn wounds where a person had taken a cigarette lighter and had heated a wire hanger repeatedly and had branded this child over 50 separate times. And as soon as I finished with that child in the emergency room and operating room, attending to her needs, another child had come in who'd had the bulk of his right arm severed with a kitchen knife. It took me about 8 hours in surgery to reattach that child's arm. In both of these cases, both of these same children, same day, called Child Protective Services, didn't see anyone from DSS come out. When we have true horrible, awful actions, they're just not there. Yet I've also seen many situations where a potentially adoptable child, a young, attractive child, has been ripped away from their parents, and family members have reached out to be a source of comfort to that child, only to be denied. Under those circumstances, you can often see the DSS people running to the door and doing everything they can to make sure that that child gets into the system and ultimately gets placed somewhere else. That's where they get their money. As a doctor, we find that just unbelievably repugnant. But this is the system we fight. This is the system we deal with. I think Lewis Carroll said it best in the Alice Through the Looking Glass thing, is stranger and stranger. That is the current status of Child Protective Services in so many states. Now, I come here today from South Carolina, and it's funny, the person before us on the stand here, Mr. Levy, said, bring a woman along. That's certainly our governor's new motto. But South Carolina has some unique problems. One of the things Zena asked me to talk about today was sort of access to care and how that impacts some of these issues. In South Carolina, we have the highest uninsured rate in the entire United States. 30% of South Carolinians have no health care, have no health insurance. And we rank 49th or 50th in virtually every monitor of meaningful health care. We talk about health care reform, and that has been a huge topic in this building behind me over the past couple weeks, and will continue to be. The problem we run into on all of these issues comes down to accountability. We cannot have meaningful healthcare reform if we don't have accountability in how healthcare is delivered. We cannot have meaningful reform when it comes to child protective services and protecting families unless accountability is made part of that.